Happy Wednesday, everyone, and welcome to Back Talks with Dr. Sean McWilliams, where we are a community centered on people that are looking for non-surgical, non-drug approaches to manage and get over their spinal pain, neck pain, low back pain, bulging discs, herniated discs, spinal stenosis, facet arthropathy. If you're one of them, welcome to our live. It's great to have you here. We come live every single week to provide you with the most up-to-date information to help you make the best decisions and help guide you in being able to manage and be successful in feeling great again without having to have surgery. So welcome to the show. Today we're going to be talking about epidurals. And if you are live with us today, please say hello. Let us know where you're from. And if you have questions, I want to answer them for you because I want you leaving today from the show feeling more confident in which direction to go and how to navigate these unfortunate circumstances that we all go through. And I hurt my back as well at one point, so I'm right there with you. If you've been with me for a while, you've probably seen a couple of those pictures that I've showed, and they weren't pretty. So it's wonderful to have you here. So, and if you don't see a response from me, make sure you send it again or refresh your browser. Sometimes with Facebook and YouTube, it doesn't always work as beautifully and seamlessly as we would like for it. So if you're on here, say hello, because I'd love to say hello to you. So let's talk about it. We're going to be talking about epidurals and what are epidurals. So let's get on with it. So epidurals, unlocking the truth about spinal epidurals. So what is an epidural? How are they administered? Are they safe for you? Do you have other options besides epidurals if you go to your doctor and you're having significant back pain and they're saying, let's go do an epidural on you? So let's answer those questions for you today. And I think I got some pretty cool slides here to share with you. So let's look at this one. So what is an epidural? Well, an epidural, and get this, listen to me closely here, is a non-FDA approved injection to reduce pain and inflammation on the spinal cord. It's not, look it up. So you are taking a risk. A lot of the clinics will actually tell you that it is FDA approved, but that is not the case. So you need to know that. It is typically used for doctors for radicular pain. That's pain that usually goes down the arms, hands, or fingers, buttocks, legs, and feet, spinal stenosis, and bulging and herniated discs. The drug most commonly used is depomedrol most of the time. You can see there's a couple other ones that they use as well. Depo is usually the biggest one, the most common one, and they're typically given with patients face down, as you can see over here in this picture. The needle is guided by the doctor with an x-ray machine for needle placement, and that's how it works. So what is depomedrol? Well, it is a steroid that prevents the release of substances in the body that cause inflammation. It's used to treat many different inflammatory conditions such as arthritis, lupus, psoriasis, ulcerative colitis, allergic disorders, gland like endocrine disorders, and conditions that affect the skin, eyes, lungs, stomach, nervous system, or blood cells. So does it have benefits? Yeah, it definitely does. The problem is it's not approved for what you're getting injected for in your back. So you're taking a big risk right there. So how does the epidural work? Well, the main goal that they're trying to do is attempt to inject this steroid just above the dura mater to reduce inflammation. So what's that mean? Well, let's take a look here. So let's look at this picture. So what you're looking at right here is you are looking at the needle that you can see here. So this is the needle that the doctor's injecting into your back. It's going through ligaments. These pieces that I have circled right here in the red, those are your spinous processes. So those are the bumps that go down the middle of your back. So they're going to be taking that needle between these bones, these bony parts, and going in, puncturing through the purple piece without, well, the goal is not to hit this part right here. Okay? Because if you puncture that, you're in big trouble. So I show you a picture on the next slide here that kind of helps you see it a little bit better. And again, so needle, pretty straightforward, I think, going in here and squirting this epidural steroid into this space just below this area that I'm circling in. Okay? And all the blue that you see here is all the steroid. that they're putting in there with hopes that it migrates into the nervous system and help you feel better. So let's take another look here. I'll show you kind of a just cool different angle. So what you're looking at right here is this is your spinal cord. You can see my finger. I'll use this to show you. So that's your spinal cord right there. And what they are doing is they are going in to this space, all right, here with that needle, and they're going to be injecting that steroid into that place. Very, very close to that spinal cord right there. Okay? So that's what's happening when you get it. But if they hit this spinal cord, or if they go through these tissues and touch that, you're in serious trouble. Okay? And I don't want you getting in serious trouble. And so let's take a look at this. So this is kind of a different picture right here. This is actually a true anatomical picture of what we look like on the inside. And what they're doing is they're going and just putting that fluid just on the outside of this dura mater. Okay? But you can see here's your nerve roots coming off of your spinal cord. Okay? You get the spinal cord all through here. You have your major nerve roots that are coming off. These are the ones that go down. They come off the spinal cord and then they branch, right? And then they exit out. If you hit any one of those structures with that needle or with that drug, you can get a really serious thing called arachniditis. You do not want that. That is not fun at all. If you don't believe me, you're going to want to go and watch this next video. I won't play it today, but if you are considering getting this done, I want you to go take a look at this. How do epidurals work and are they safe? By a Dr. Oz investigation, you can see that lady with in horrific pain. And the reason that she's in horrific pain is because someone didn't do their job right. They went too far and she wound up getting arachniditis, which is inflammation in the arachnoid matter. It's incredibly painful if you watch this. And, you know, I share this with you not to scare you. I want you to realize that you have other options. I have sent patients for epidurals that came into my office that were in excruciating pain, and I got to be honest with you, and I want to be honest with you because I think it's really important. Almost everybody that came back, it did not make a difference for them, and probably half of them actually felt worse after the epidural. And you're puncturing your tissues, so anytime you do that, you know, you have a greater chance of infection and a pain. And then your body has to heal from that as well. So, you know, I don't want this to be number one. If you go to your doctor and they're telling you need an epidural, you know, this should not be number one option to manage this. There's much more safer things that you can do. And remember, when you do an epidural, you're putting a Band-Aid on the situation. It's just like, you know, if you live up north, you know there's potholes. And, you know, if they just patch them up and just fill that hole, you know, within a couple months. And as cars go over that and it rains and it gets cold, that thing starts breaking apart again. And it's the same thing happens in our spine if we don't get it to fix itself correctly. And usually the best way to do that in most cases, unless there's a major trauma that has happened, is to do it naturally. And that's why we created Disc University, to help you do that from the comfort of your home. So when you get a minute, if you're considering epidurals, go watch this video. You can find it on YouTube. It's called Are Epidural Steroids Safe? A Dr. Oz investigation. It's probably about 15 minutes. It's definitely worth your watch. You're going to see just how much corruption, unfortunately, is taking place in our United States because lots of people get this stuff. So go take a look at that. So do you have other options? Yeah, of course you have other options. And like, you know, if you've been with us for a while, spinal decompression is the number one option in most cases for any sort of bulging disc, herniated disc, facet arthritis, also known as facet arthropathy, or most spinal stenosis. And most spinal stenosis are where the nerves branch off of the spinal column. So it's this hole right here where this nerve branch comes off on both sides, which is usually where it's causing the compression at. Sometimes you'll see it in the spinal cord as well. All right, so sometimes you'll see where this canal starts getting smaller. And the beautiful part is that spinal decompression can do a really good job, especially if there's a bulging or herniated disc there. So you always want to go spinal decompression first, but you want to be doing it by someone who can show you how to do it correctly, who's nationally certified in it, and really knows what they're doing, and has a long history of very high success rates for his clients and patients. Okay, you don't want to just go to anybody. And the beautiful part is you don't have to even worry about that anymore, because that's why I created Disc University, just for you or people that you love who are suffering with this, but you can actually do this from the comfort of your home. I help guide you and coach you through the process. You can do it by yourself, just with our video courses and modules. They're very explanatory. Or if you feel like you want your hand held a little bit more, you want to check in with somebody on a weekly basis live in a group where you can ask questions, just have a cheerleader there for you, share your successes. If there's anything that we need to help tweak for you, we can do that. You can also do that as well. We have options for you to do that. So I hope that you'll go take a look at it. And because if you look at this, spinal decompression isn't a patch. It's helping your body heal itself from the inside out, taking degenerative discs like you're seeing right here and getting them to start to have more blood supply, more nutrition, more oxygen, all the things that a disc needs to heal itself. And you don't get that from an epidural or a discectomy or a nerve ablation or a facet injection. None of those things happen for you if you go that route. But if you go this route, you have a very high chance of actually not only correcting it, but keeping it healthy for the rest of your life. And here's a case study to show you that exact thing. So you can see here, this big massive red area that I've outlined is a massive disc herniation. When you go over to what's called the axial view, again, you can see this big massive blob of disc material pushing onto this nerve right there. Severe low back pain going down their leg. This is them. Now this is a person that would have easily been told to get an epidural, or probably even a discectomy or a laminectomy. All right, I want you to know that if this is you right now, or someone that you love, and you are getting told that, that is what you're going to get told most commonly. And I want you to show you that if you remember what these look like right here, and you come over here, this is the same person 12 weeks later doing spinal decompression under my guidance. And that's the changes that you can make in your body with probably an 80+% success rate for most people. And here you can actually start to even see the white nerve branch. You remember how that big black blob came all the way down to here like that? Look how much that is pulled back just from doing the right thing to help get the disc to be healthy again and pull that material back into it. Listen, before you go and get epidurals, please, please, please reach out to me. If you want to talk to me on a Zoom call, you can go to bookings.drshawnmcwilliams.com and you can schedule an appointment with me. I'm doing it at my expense right now just because we just launched Disc University, and I want to help you, or I want to help your loved ones. And I know it's a confusing part of the world to navigate back pain. It's hard to understand MRIs. There's lots of things that people are gonna offer you. I know that people are in discomfort and in pain, and it's tough to make decisions like that. And that's why I'm offering this complimentary. Normally it was $197 to talk to me for 20 minutes on the phone. Now I'm doing it complimentary. So you can go to bookings.drshawnmcwilliams.com and you can get on my calendar and we'll chat for a few minutes. And if you have images, you can show them to me. I'd be happy to help you navigate this. And if I think Disc University, the course that we've created and worked really hard on so that you can do this from the comfort of your home, you don't have to go find a doctor in your community, I'll share it with you. And if I don't think it's the right fit for you, I'll be honest with you, I'll tell you that too, but I'm also going to help you try to help get you to the right person, okay? So it's always a pleasure. Hey, if you like this, if you haven't subscribed to our channel, I hope I've earned that right to earn your confidence and trust, and I hope that you will subscribe to our channel. We put these out every single week on different topics and new topics. If you got a topic that you'd like to learn about, let me know. I'd be happy to try to do that for you, and I hope that you'll give it a thumbs up and you'll share this with other people. That's how we get this message out to the world, and more people need this because they're getting driven by doctors who are financially driven in their practices to go do these things, and they don't really always care if you get better or not, but I care if you get better. And I want to help you get better. And I don't want you to keep being on this merry-go-round of pain, pain, and no pain for the rest of your life. I want you to start being the mom or dad that you dream about being again, being able to play with your children perhaps, maybe going on that vacation that you thought you'd never be able to because you didn't trust your back. Maybe you're a grandparent and you're afraid to hold your grandchild because you're afraid that your arms were going to go weak or your legs were going to go weak and you were going to drop that baby. Not a good feeling, right? You want to love on them. So maybe go back to work and be able to provide for your family so you feel good inside. Just wake up without pain consistently. Wouldn't that be amazing? So that's what we do. And that's what we created in Disc University. That's why I worked so hard for the last 1.5 years. And I would love to share that with you and teach you how to do it from your home. Okay? So, but if you'd like to chat, get on my calendar. Let's talk. Let's see if we can help you start having the quality of life that you dream about and start making that a reality. All right, guys, I appreciate you. Thanks for being here today, and I'll see you next Wednesday.